The DASH diet is not my #1 recommendation because by the time a lot of patients come to see me in the hospital, they already have established high blood pressure and are requiring 2 to 3 medications. Hey everybody, welcome back to my channel. Today we're going to talk about how to lower blood pressure naturally. If you like this content, don't forget to give me a thumbs up and subscribe. Let's go ahead and start. High blood pressure is often silent. People will not know about it until they get their blood pressure checked, whether in a hospital or in the doctor's office. Blood pressure is an instigator. High blood pressure has led to the development of heart disease, stroke, kidney disease, and other problems. And often it is silent. Patients will not have any symptoms. So let's talk about the different methods that you can lower your blood pressure naturally. We're going to start off with one big clarification. I do not want to give you medications for blood pressure control. The main reason I will prescribe blood pressure medications to patients with new onset hypertension or uncontrolled hypertension is to lower their risk for developing stroke, heart attack, chronic kidney disease, and other problems down the line. The good news is that lifestyle changes, in addition to the blood pressure medications, can help in concert to lower the blood pressure to live a better quality of life. Now, we're going to start off with talking about the DASH diet, which is known as the dietary approaches to stop hypertension. It mainly is involved in talking about a restriction in the types of foods that can and can't be consumed. But it is designed to be practical, flexible, and effective, and it gives specific details regarding how many foods to eat and of which types. The benefits of this diet have shown that blood pressures can drop as much as 5.5 points and even higher at around 11 points in patients who actually have high blood pressure. There must be per day 4 to 5 servings of vegetables, 4 to 5 servings of fruits, 2 to 3 servings of low-fat or fat-free dairy products, 6 to 8 servings of whole grains such as brown rice, oats, or whole wheat bread, 6 or fewer ounces of lean meat, poultry, or fish per day, 4 to 5 weekly servings of nuts, seeds, or legumes for heart-healthy plant-based proteins. Now, the diet also limits the intake of your highly saturated fats, such as in the form of red meats. It also requests that full-fat dairy be omitted and that there be a limitation on sweets and sugary drinks, which are capped at no more than 5 servings per week. That's almost 1 per weekday, which seems a bit high per my standards, but that is what you are allowed to have. And then fats should make up no more than 27% of daily calories, with a preference of healthy unsaturated fats such as in avocado oils or in olive oils. In addition to this DASH diet, there are some strict guidelines on sodium intake. You are allowed to have up to 2,300 milligrams of sodium per day, which has been shown to help improve blood pressure readings. But more stricter guidelines of 1,500 milligrams per day has shown even more effect. And it is ideal for women with hypertension or higher risk. In the DASH sodium trial, cutting the sodium lowered the systolic blood pressure at around 11 to 12 points in hypertensive women. How do you avoid stealth salt? Think about salt in packaged foods. It's often used as a derivative to help preserve the food to last longer. But there are also higher amounts of sodium in canned fruits, vegetables, and foods. Also, think about salt in your processed and cured meats. Now we're going to talk about potassium and other nutrients. There is data to show that a diet high in naturally existing potassium has led to an improvement in blood pressures, including magnesium supplements as well. And then in an earlier video, I had talked about how calcium was also shown to lower blood pressures. Having said that, do not at any cost go out and purchase potassium-containing pills or supplements. This is incredibly dangerous. Potassium has to be maintained in a narrow range in the body, and too high or too low potassium levels can cause a fatal heart rhythm. So if your potassium is not being kept up because of your diet, you may be one of those few individuals that can benefit from potassium supplementation. but wait for a physician to advise you on whether or not you need to take potassium. I've talked about this before when it comes to non-dietary lifestyle changes. Exercise can't be emphasized enough. We've got to have 150 minutes of moderate intensity physical activity per week. We're talking about 30 minutes per weekday. Then weight loss of anywhere from 5 to 10 pounds has also been shown to help reduce blood pressures by around 5. Quit smoking. Limit drinking to no more than 1 alcoholic beverage per day. And then finally, stress management is also on the list. Trials show DASH works. In a longitudinal cohort of nurses, the data observed was found that women who consumed fruits, vegetables, followed the DASH diet, limited their sodium intake, limited their alcohol intake, and exercised were 78% less likely to develop high blood pressure down the line. These changes mean that limiting your blood pressure actually can lead to a reduction in diseases affecting your brain, heart, and kidneys. The DASH diet is not my number one recommendation because by the time a lot of patients come to see me in the hospital, they already have established high blood pressure and are requiring 2 to 3 medications. At that point, it's all a matter of managing the pills. However, what I do tell my patients is that there is still a benefit to helping to drop that blood pressure by even 5 points. And the studies are pretty convincing and consistent in weight loss, in improving the intake of fruits and vegetables, in reducing red meats, in exercising and quitting smoking and limiting alcohol can all lead to beneficial changes in blood pressure management. But there's also evidence to show this. Positive changes in one aspect of life, including positive habits, have been linked to the formation of other good habits as well. And that leads to small success over a long period of time. If you like this content, follow me. I'm here to make medicine make sense. Until next time.